A machine check and power cycle, that means switching the machine off and on, should ideally be performed every day. In intensive care use, when patients are ventilated for prolonged periods of time, this is clearly not practicable. A full power cycle and machine check must be performed before a new patient is attached to the Aisys CS2. When the same patient is on the ventilator for several days, a full power cycle and machine check should be done every 7 days. A full check takes approximately 15 minutes and the patient will need to be ventilated with a transport ventilator during that time. In order to perform a full check, we need to first turn on the anaesthetic machine. It will take up to a minute for the machine to power up. When the black checkout menu appears, we press the full test button to commence the automatic checkout. The instructions on the screen are very clear and easy to follow. First of all, we flick the green ventilator switch from left to right. We then ensure that the Y piece of the circuit is not obstructed. We then check that the auxiliary common gas outlet at the front of the anaesthetic machine is switched to circle. And finally, we check the flow sensors. Unlock the casing by pulling the green handle towards you. The whole block then detaches easily and the flow sensors can be inspected for any obstruction. Once done, reattach and lock with a green handle. We are now ready to press start and the machine will perform the check automatically. This takes about half a minute. Once complete, we need to change the configuration of our circuit. We need to ensure that the bellows are completely empty and occlude the Y piece by connecting it to the little plug on the left-hand side of the anaesthetic machine. We can then press continue on the touch screen. Even though the anaesthetic machine has passed its test, we expect 2 error messages to appear. The first one refers to the absence of an anaesthetic vapor cassette. We are not sedating with anaesthetic agents during intensive care ventilation, therefore this recess will remain empty. The second error message refers to nitrous oxide, or N2O, which we're also not using in intensive care. We can proceed by pressing accept. In the next step, the machine will test the APL valve and manual circuit. For that, we will flick the switch back to manual and adjust the APL valve to halfway between 30 and 70 centimeters of water. We're then ready to press start again. During this phase, the manual bag will start to fill. Checkout is now complete and we're ready to start ventilating our patient. However, before we connect our patient, we need to ensure that the APL valve is fully open and that our green bag is slack again. In summary, the machine needs to be checked before every new patient and at least every 7 days. If you are about to start ventilating a new patient and see this message, turn the machine off and on and perform a full check first. If you are ventilating a patient for longer than a day, the machine will prompt you to do a full checkout every 24 hours. This should be rejected. If more than 24 hours have passed without a checkout, do not press the end case button, otherwise the machine will lose all its previous calculations and variables such as tidal volume and flow will become inaccurate. After a maximum of 7 days, the machine must undergo a power cycle and a full checkout. This is the end of part 3. Please watch part 4 for ventilator settings.